Dropped our health insurance in 2025, and I've had a lot of people commenting on my video from earlier in January, just asking how everything has gone. So I took down some numbers and I'm going to break it down for you guys. We have had medical costs this year because we're a family of 7. Obviously, someone's going to have to go to the doctor. So I was going to break it down and give you some exact numbers. Now, we were paying roughly, I did have my numbers wrong in January. We were paying closer to $1,000 a month, not $1,200. $1,000 a month for insurance for 5 of us. 2 of my kids are on state health care. They were adopted through the foster care system. They get state health care until they're 21. So that covers 5 of us, $1,000 a month. That was for dental, medical, vision. And so we dropped our PPO, and what we pay now is $137 a month, and that is for dental and vision. My kids go every 6 months to the dentist's office religiously. They've never had a cavity. They have good teeth. We don't have any of the issues there. We never pay a penny for it. So that to me is well worth keeping that insurance. We have accident insurance, hospital indemnity, which means if we were to be hospitalized, they would pay us cash so much money per day that we are in the hospital. So it's not insurance, it's not covering what's being done, but it's like a buffer. We also have critical care insurance and basic life and death and dismemberment insurance. We still have that. That is $137.26. Instead of traditional insurance, we decided to do direct primary care. So we pay $265 a month for all 7 of us. That covers all in-person and telehealth visits, all in-house labs, point of care tests, so that's flu, COVID, UTI, strep tests, all orthopedic visits. We also get discounts on like x-rays, IV infusions, anything like that. We have after hours access to our provider, including texting, which we do often. They also have an in-house pharmacy, which is much cheaper and has saved us quite a bit in the long run whenever it comes to medications. So the price for all of us for the whole year for the direct primary care is $3,180. That's for all 7 of us. So that's a little over 3 months worth of our primary insurance that we had previously. So our medical costs for this year, we did have several doctor's visits. So we had one appointment that had labs outside of the office, so that was $35. We had a pediatric sick visit with lab draws, $0. Adult sick visits with labs, $0. I went in one time for an IV infusion. It was $157. We had adult new patient appointments free, a pediatric appointment with an x-ray and labs. That was $140. We also had one of our kids need a CT scan, which we paid out of pocket for. We paid $340 for a CT scan of our child at an independent imaging clinic. We have paid that. We've paid more than that for a CT scan after insurance already paid their part. Make it make sense. We had multiple pediatric visits. We had 2 well child, like just checkups. Those were all free. We had 2 sets of dental cleanings for 4 kids. My kids that are still minors, those are free. I had to go to a dermatologist to go and get a checkup. I try to go every year. That appointment was $150. I did have to have 3 biopsies, and that was $189. All 3 of those biopsies were precancerous, so I had to have them all removed. So I had to have 3 like minor surgeries. That was $2,400. For all of our medical appointments, labs, x-rays, scans, everything like that, the total cost was $3,420.50 for everything. Medications, we pay cash out of pocket. My husband is on a trizepatide injection. We paid $290 a month for that. That just started a couple months ago. And antibiotics are usually between $4 and $12. We've had to do that once or twice. And then any other medications that we've had have been between $7 and $30 a month. Less than $7,000 for our primary care and all of our appointments. But you have to look at it like this. We don't have copays. Every single appointment that we walk into our clinic, we would have had a copay of at least $100. At least $100. Then we would have had to pay for the labs. and paying our premiums as well. So I have not done the math on how much we have saved, but this would be about 12 or about 6 months worth of premium payments if we would have kept our plan. I also know that premium payment is going up drastically this year. So I know a lot of people are looking into dropping their insurance. I'm not here to encourage anyone to drop their insurance, okay? I don't think that'd be very, very responsible of me. You need to do your own research, see if it makes sense for you. It makes sense for us right now. I don't know that it will always make sense. But this is kind of what we're doing now. My son is going to start doing some neurological therapies starting tomorrow. The whole thing is going to be about $4,000 out of pocket. That includes 3 brain scans. That includes 20 sessions of neurofeedback. And it includes cognitive testing and nutritional appointments, a whole plethora of things. So even with that, we're still paying less than we would have just for our premium payments for the year. That's all I'm saying. So if you have any questions, please let me know. I'm sure this is like a ton of information and it's a little overwhelming. For us, it made sense. And I will do some more follow-up videos. I'm going to try to add up what our costs would have been if we would have done that with insurance, but I'm not sure I'll get to that today. If you've considered dropping your insurance or if you have dropped your insurance, please let me know how it went for you.